Hello there, welcome to the third installation of putting Dr. G on the spot. In the whole month of May, we're focusing on all the abnormal swelling in the testicle. And this week, we're focusing on inguinal hernia. By definition, a hernia is a protrusion of a structure that it shouldn't really be there due to abdominal wall weakness. And in the groin, it can be a femoral hernia or an inguinal hernia. An inguinal hernia actually have a lifetime risk of 27% in men and 3% in women. Actually, men are 8 times more likely to develop inguinal hernia due to our anatomical structure. Imagine as a child in gestation, our testicle actually is abdominal content inside the abdomen. With time, after 7 months of development in gestation, the testicle will move to the scrotum for a lower temperature, bringing all the structures such as the artery, the vein, and the vas. Because of that, there is a small canal called inguinal canal. When we are young and the musculature of our body is strong, that canal is closed and then all the abdominal content retains in the abdomen. But as we get older, more than 50 years old, perhaps because of smokers, constant coughing, putting on weight, straining because of constipation or straining because of urinary tract obstruction, then the abdominal wall becomes weaker and hernia becomes a protrusion of a structure. Hernia itself can be a direct hernia or indirect hernia. It can be in the groin or all the way into the scrotum. Most men will have some degree of discomfort, especially if the hernia gets bigger. For some men, that itself will get in the way when you have sexual intercourse, or sometimes in a very severe situation where the abdominal contents such as the bowel get strangulated in a hernia, then it becomes a medical emergency, may even be life-threatening. So for some men, the hernia itself can be a bit of a nuisance and you live with it without any need for surgery. However, if the hernia itself is quite uncomfortable or actually is getting too big and gets in the way, especially when it comes to sexual intercourse, an operation is definitively needed in order to resolve this problem. The operation itself can be done with an open surgery, which we put a mesh inside to strengthen that abdominal wall, or we can do it laparoscopically, which is a keyhole operation in order to bring the hernia back into the abdominal content and then put a mesh internally to stop the abdominal content from leaking into the scrotal wall. In order to avoid hernia, you need to keep healthy, exercise regularly to build the strength of the muscle in the abdominal wall, and don't smoke because coughing and straining and also constipation itself will make the hernia worse. For the final installations of the month of May, we're talking about epididymoorchitis. A bit of mouthful, essentially it's an infection of the testicle and the surrounding structure of the testicle itself. Then you need to stay tuned for putting Dr. G on the spot.